Good afternoon, everyone. Thank you for joining us at Families Together's Town Hall on Child Welfare. For those of you who have attended in the past and who have been attending these town halls over the past couple of weeks, you know that each of our town halls focuses on a specific area in which our families and young people are involved in. I'm Paige Pierce. I'm the CEO at Families Together New York State, and we're pleased to be able to bring these town halls to you again. Every year, we're able to get the chairs of each the Senate and the Assembly committees on this particular topic, and commissioners or deputy commissioners from each of those state agencies to be able to address questions and concerns from our family members and young people who all across the state have shared with us their concerns, which has helped develop our policy agenda at Families Together. And so this is an opportunity for policymakers and policy implementers to be able to address those and tell us all across the state what they're doing in Albany to help. So we have one more town hall after this, and that is on Wednesday for Youth Justice Town Hall. And then we have on March 19th in person, the Family Empowerment Day at the Legislative Office Building. If you go on our website, you can see if there's a bus coming from your area. We still have room on the buses, and we would encourage everyone and anyone to come join us. There'll be lunch, there'll be speakers, there'll be a rally, and opportunities to meet with legislators on issues that are important to you. I also want to just take a second to thank Brad Hansen and Zach Kilmer, who have been the reason that these town halls exist to begin with, and that they have gone off so smoothly. The backroom work that goes on to make these things go off so well is really commendable. And thank you so much, Brad and Zach. So today we have Senator Brisport, who's the chair of Children and Families in the New York State Senate, who'll be joining us shortly. And also we have with us the Deputy Commissioner of the Office of Children and Family Services, who's specifically in charge of child welfare. So I'd like to just introduce Gail for you to be able to introduce yourself and say a few words.
Thanks, Paige. Good afternoon, everyone. As Paige referenced, my name is Gail Gahagan-Pratt. I'm the Deputy Commissioner at the Office of Children and Family Services, overseeing the Child Welfare and Community Services Division. I've been in the Deputy Commissioner role for approximately 4 months now. Prior to that, I joined the OCFS team in February of 2020 as an Associate Commissioner here in the Child Welfare Division. Prior to that, I was at Albany County Department for Children, Youth, and Families, where my career expanded over 20 years, starting out as a frontline worker in CPS and culminating in being the commissioner prior to leaving the agency and coming to OCFS. So I have over 25 years of experience within the child welfare arena. I can appreciate the history and the impact of child welfare, and I appreciate the direction that we're trying to go. And so I look forward to being able to engage in conversation with you today and being able to respond to questions that you have.
Thank you so much, Gail. And while we wait for the senator to join, I wonder if you want to just share a little bit about some of the wonderful work that you're doing, partnering with Families Together and others to ensure that there's authentic family voice within your system and to really create systems change.
Absolutely. Didn't want to see like I was showing favor, but yes, I certainly do want to highlight the work that we're doing with Paige and Families Together in terms of having family policy advisors as part of the team here at OCFS. Some of our policy advisors have been with us well over a year now. And it was really an integral part when we're talking about looking historically at the child welfare system and the direction that we're trying to go in, recognizing that part of that really entails that we have family voice and persons with lived experience who are meaningfully contributing to the work, meaningfully being at the table when policies are being developed, as well as looking at the types of programs and services that we support. And so have really appreciated this collaboration with Families Together. I see Melinda, who is one of our family policy advisors. I look at this as we're in our infancy, and so we are growing. And as we continue to move forward, we're continuously assessing what is working well, where are those areas that we still have an opportunity to grow and improve, because this is not something that we want to just have as a checkbox. This is something that we feel is really important and integral as we move the work forward. So again, really value the family policy advisors as meaningful collaborators with the work that we're doing here at OCFS.
Thank you, Gail. And I just want to put in a plug really quickly, because for those who are watching or listening that have been with Families Together for many years, you know how long we've been wanting to have the kind of family voice in the child welfare system that we now are getting, thanks to Gail and her colleagues over at OCFS. This has been decades of work, and we are just so grateful for the partnership. We know that the families that we've worked with and that we serve are often have involvement in the child welfare system, the juvenile justice system, DD, OASIS, state ed, in addition to mental health. So we're just so grateful for the recognition over at OCFS that our families are important and they matter. So with that, I'm going to turn it over to Brad Hansen, who's the director of our public policy, and he's going to be the moderator today. Thanks, Brad.
Thank you so much. And thank you everybody for being here. Thank you for all the amazing ambassadors for working with us to put questions. And thank you, Deputy Commissioner, for being with us and sharing space and trying to explore ways that we can really advance the mission of child well-being, child and family well-being in New York State. I'm going to kick it off first with TJ, if you want to ask your first question.
Good morning, Deputy Commissioner. I'm TJ Curlers, hailing from Brooklyn, New York, serving as a family training coordinator at Families Together. With extensive experience as both a youth and a parent advocate, having worked in residential treatment and leading men's support groups, I've witnessed concerning trends, particularly the rise in youth and men's suicide, coupled with limited jobs and educational prospects. Through my work, I've observed a disconnection among men from the economy, society, and the workforce, evident in the rising crime and suicide rates. It's evident that fostering a sense of belonging and support is crucial for youth to thrive. I would like to know what New York State's efforts are in providing positive roles for young men to deter criminal involvement and establishing safe spaces for those grappling with hopelessness and mental health issues.
Thanks, Curtis. Tyrus, sorry. I am going to take your question in component by component. So please, if there's any area that I am not being responsive to, let me know. So the first thing I will say is that fatherhood involvement has been an area that OCFS has been particularly attentive to over the years. It's one of, as we talk about the work that we do with families, really promoting that fathers are a part of that work we do. I think historically we know that child welfare has been very much focused on the maternal side and working with mothers. And so we have a program area within OCFS that is really looking at how we are better able to engage fathers. What are our policy and practice protocols that we are providing to the districts to be able to support and move that work forward. As I take it down in terms of speaking to young men and youth, we have been doing some collaboration with other stakeholders who need to be a part of this work. So we've been having conversations, for example, with the Department of Labor in terms of how do we start to identify opportunities when it comes to internships, when it comes to vocational opportunities, you know, looking at partnering with some of the local unions when it comes to areas such as being an electrician or plumbing, you know, really looking at those areas where we know that that really is able to support a viable living wage. Also looking at how we partner with some of our local colleges in terms of, again, creating opportunities in terms of secondary educational goals that our folks will have, may want to pursue. Additionally, we are working specifically with youth transitioning out of care. We're partnering with Chapin Hall in terms of looking at the current outcomes, which we know are not great, especially when it comes to transitioning and the challenges with homelessness, the challenges with housing, the challenges when it comes to viable and livable wages. And so really partnering in a meaningful way in terms of what are those additional supports that we need to, that we really need to identify to support much more successful transitioning from foster care into adulthood for our older youth. Does that, please, if you have any follow-up, if there's anything that I have not been responsive to, please let me know.
Just a couple was with the rising crime and suicide rates pertaining to some of that is a big concern.
Yes, so I'll start with the suicide rates. This is, it's interesting because we have our fatality work group and we're tracking, you know, data when it comes to what we're seeing in terms of trends, as well as conversations that we're having with our partners with the Office of Mental Health. And we are very much aware of the alarming trend of suicide, whether it's attempts or completion. And so again, what are the ways in which we can partner? Because, you know, this is not necessarily our wheelhouse, but certainly the ways in which we can partner with others who have that level of expertise in terms of the programs and services that we can collaborate on.
Thank you.
Yes, thank you so much for a very thoughtful response, Deputy Commissioner. I'm going to pass it forward now to Sabrina Anderson from New York City. And Sabrina, feel free to ask your question.
Hi, Deputy Commissioner. My name is Sabrina Anderson. I'm born and raised in Long Island, New York. I've lived experience in the child welfare system and I've spent time in congregate care placements from about 12 to 17. My experience has deepened my advocacy and really highlighted the limited pathways for current and former foster youth to be successful post-care. Congregate care placements have proven to have adverse effects on young people and disproportionately youth of color. And these outcomes do not justify the outrageous financial costs of these placements, money that could flow into the community and back to the family itself. Furthermore, the implementation of Family First held great promise, but now is failing to deliver on phasing out of these harmful placements. So what changes or approaches can be taken for preventative care and family reunification to be a reality and not just a fantasy?
Mm-hmm. Thank you, Sabrina. Appreciate the comprehensiveness of the question, as well as some key areas that you have honed in on. And so when I introduced myself and I talked about, we know what has been the historical impacts of the child welfare system, you're definitely highlighting some of those key areas. You know, you referenced Family First, and there was a lot of excitement, if you will, in terms of, you know, the direction that Family First was really espousing to go, really emphasizing prevention and supporting families and minimizing out-of-home placements, and in particular, the highest level of out-of-home placements in terms of congregate care. I appreciate that, you know, We have not fully achieved the intent of Family First, but I think we continue to strive to get there. At the onset of Family First implementation, OCFS identified specific outcome markers that we were trying to achieve. So so I'm going to start at one place, but I'm going to go back to the prevention because we are doing work with that. But in those circumstances where there were concerns around safety of a child that could not be mitigated in terms of a safety plan, and there needed to still be a removal to address the immediate safety concerns, one of the goals that we set was that any child that was being removed from their home, 50% of all children in care need to be with kinship. We strongly feel that if a child needs to be removed from their home, that emphasizing and looking at family as the first line, or folks that have had meaningful relationships with a child, is where we need to start, family-based and kinship. And that we set a goal of 50%. When we started, we were at approximately 30%. We have seen some achievement in that we are about 42%. So we haven't achieved the 50%, but you know, we are seeing meaningful progress there in terms of when a child needs to be removed from their home. In terms of congregate care, we set a goal that no more than 12% of all youth in foster care would be in a congregate care setting. When we started out, we were at approximately 16, 17%. We're at about 14%. So again, we still haven't gotten there, but I know that our numbers are coming down, and we're continuing to look at, continuing to ensure that if there is a need for out-of-home placement, and if there is a treatment need that rises to the level of congregate care, that it is for the amount of time needed, and that their treatment needs align with for that child, and that we are expediting permanency. So that's on that end. But let me talk about really what is the important end, which is prevention, right? So how do we actually support families so that is not occurring? So as part of the work under Family First, we really wanted to emphasize upstream supports. So when it comes to preventive services, we have what we call our tertiary services, the ones where families are accessing because they have actually had formal involvement with child welfare. Well, our goal is to be able to push those services further upstream so that you don't have to access services by actually having interface with the child welfare system. So we've invested in a number of supports, our family opportunity centers. We recently brought on a number of those services and supports. They're community-based, and have linked some of those family opportunity centers are collaborations with state ed. So they're interfacing with some schools as well, so that when we're talking about accessibility and the ability to really access those services in an immediate way and in a way that is approachable, that is one of the ways that we are making investments. We've made investments with mobile response vans. You may be familiar with the mobile crisis vans under OMH. These mobile response vans, they are not that, but it's really about bringing services and supports to families. So whether or not, for distance of where a family resides, transportation, or just the benefit of having services being able to come to a family. We've made investments with mobile response vans that has resources available on those vans, such as a family parent advocate, as well as if there is a need, a DV advocate, behavioral health specialist. So trying to be comprehensive in that response. Additionally, we are making investments in our evidence-based programs. So that's under Family First, there are a number of what we call EBPs that can be supported under Family First. And so we're also making investments in that way. Again, how to be able to be more proactive on the prevention end. We are actually, as a state, supporting Breeze Strategic Family therapies as one of the EBPs that the state is actually standing up and supporting with Family First funding. We're also supporting the CQI around motivational interviewing. So we already provide the training through our training program at here at OCFS. And then we're, as part of the Family First requirements, there we also have to demonstrate model fidelity and continuous quality improvement. And so as part of the Family First transition funds that we receive, we're building in that support. Both of those that I just referenced, the Breeze Strategic Family Therapies, as well as the evaluation in CQI for the MI, we're supporting through the Center for Excellence, which we recently implemented. I feel like I threw a lot out there at you, Sabrina. So if you have any follow-ups, if you need me to clarify anything, please let me know.
I feel like you hit on all the points thoroughly, and I appreciate your answer.
Thank you.
Yes, thank you so much, Sabrina, and thank you, Deputy Commissioner, for your response. I'm now going to queue up Aquila Sumter from Erie County.
Good afternoon, Deputy Commissioner. My name is Aquila Sumter. I am a family parent advocate in Erie County and a parent with lived experience navigating the child welfare system. While caseworkers and police officers have differences, they do share similarities. For example, they both have the power to remove children for various reasons. Like police officers, the training caseworkers received to be qualified for such a powerful decision is mystified and often comes across as done spitefully with no uniformed, recognizable methods that would qualify or disqualify a family experiencing a removal of their children. My question is, how can a recognizable method be constructed so families will know what to expect when they are being investigated by child welfare?
Thanks, Aquila. So again, I'm going to take some measured approaches to the response. And please, if there's anything that I am not fully responsive to, let me know. So let's start. I'm not directly asked in your question, but I'm going to take a step back in terms of families coming to the attention of child welfare. And that's part of the work that we are very much focused on, is what we categorize as narrowing the front door. So I think over the years, the child welfare door has really expanded and broadened in such a way that, it really bears the question as to whether or not everyone that is being, that a report is being made really needs a CPS report, right? And so one of the ways that we have really tried to focus on that is developing what we call the HERES line, which stands for HERES family line, which stands for help, empower, advocate, reassure, and support. And so it's really a separate line that we have developed that is accessible to families as well as providers in the community, because we recognize that there are so many other variables and factors and challenges that families could benefit from support that don't fall under the auspices of neglect or maltreatment or abuse. And so really want to make the distinction in those circumstances where a family just really needs support. Let's not make child welfare the pathway for that. Let's set up a separate pathway, because we want to really have that if a call is coming into the State Central Registry, it is because it is truly about abuse or neglect of a child. In an ideal world, I wish I was out of a job, quite honestly, because all children's needs would be met and there would not be abuse of children. But unfortunately, just coming off this weekend, abuse still happens, unfortunately. But we really need to be very clear about what are those circumstances that really warrant child welfare involvement, where versus the circumstances where it's really about being able to link families to support. So along with that, we recently updated the mandated reporter training. I don't know if you were aware of that, but it's really emphasizing that. The tagline is actually, you don't have to report a family in order to support a family. And it's really, again, providing information and guidance in terms of which of those calls really need to go to the SCR and which of the ones may be handled in a different way. We've incorporated implicit bias in that updated training. We've incorporated information about ACEs, and we've incorporated a decision tree to help support folks who are making those calls in determining whether or not that really does need to generate through the SCR. So that, I think, speaks to a way of being proactive in terms of even families coming to the attention of child welfare. For those families that there is a report that is registered, for a worker that is going to be working with that family, any new worker coming onto the job needs to go through training. We have the foundations training for child welfare, and then additionally, we have CPS response training for our CPS investigators. That is the intent of that training, is to be able to form a foundational and consistent framework for how the work is done. That is in conjunction with guidance, policy, a CPS manual that is provided. That being said, I fully appreciate that the practice may not always be consistent and it may not always look the same. That is part of the ongoing work that we do. We have our oversight and monitoring unit that actually reviews case practice for all districts as it pertains to their CPS investigations, as it pertains to foster care and prevention. We also have our regional offices, which directly liaise with the districts. And so on a quarterly basis, they are meeting with the districts and they are doing quality assurance reviews, again, looking at practice. Does that mean that there is good practice happening on a consistent basis? Unfortunately, we know that there is not. And so that is what we're continuously assessing and looking at, how do we get to consistent good practice? I think part of that is how workers engage with families when they go out in the field. Because that sets the tone right off the bat. So how that person, knocks on the door, how they greet the person, what are the words, what is the language, what is the tone, what is the presentation? All of that is so vital and important. And so that is part of the training with the foundations in terms of engagement. And then, being able to have the districts support that in terms of the supervision that occurs there. We are on a journey. Fully appreciate that. And it is something that we continuously have to assess. We also have to assess our training. And Melinda and the family policy advisors, I don't know if Melinda has gone through it yet, but we are actually having all of the family policy advisors go through the training, because again, it's important to be able to have various lens to be able to really assess the quality and the consistency of the training. And, sometimes when you're in the forest, you can no longer see the trees. So having the family policy advisors come in, bringing their lens and their perspective and their experience will really be informative in terms of being able to provide feedback about the training as well. Because again, this is setting for the foundation for the work that workers are going out and how they're engaging with families. To your point, we do have the authority based on statutes and regulations to be able to facilitate a removal if it's determined that a child is in immediate danger and that there is a need to be able to mitigate the circumstances. In all situations where a removal is being considered, part of the conversation with the family or guardian is about a safety plan. Is there someone else that would be able to care for the child where, you know, for the immediate, which gives some time to be able to address what might be the safety concerns. In those instances where a safety plan can be implemented, then that's the first line of intervention, if you will. And I will say that we're actually in the process of updating policy guidance for the field as it pertains to how to implement safety plans, or what we're calling alternate caregivers, as part of a safety plan with a family. If, you know, there isn't a safety plan, isn't able to be implemented, and the removal has to move forward, then families need to receive the proper notification in terms, you know, they're asked whether or not they consent to it. A family does not have to consent, but they do need to be asked. And then there are the required notifications that go along with that removal. There needs to be a court hearing within 72 hours of a removal. So, you know, that's where the checks and balances come into place. So child welfare may be in the immediate circumstance, be able to effectuate a removal, but then within 72 hours, that actually needs to go before the family court. The family court judge needs to review the documentation, review the you know, the outlines of the concerns that that is being presented as to why that removal occurred, and then the family court judge has to either approve or not approve that removal. So yes, there is a level of authority that child welfare has, but there's also checks and balances in regards to that as well. Okay, I'm going to pause because I feel like I've been talking and I just want to make sure that I've answered questions. And then if there's something I haven't answered, you know, hold me to that and put it back on the table.
We really appreciate that, Commissioner, and feel free if you want, if there's anything that you want to say in response, or just offer appreciation, go ahead. And then I think I have a follow-up.
Yeah,
go
thank
ahead.
you so much for answering my question so thoroughly. You spoke about the HERES line when you first started to speak, and I just wanted to know if there was any particular method of rollout to let families know that the HERES line is an option.
Yes, and we're continuously looking for opportunities to share. So, you know, we've shared it with various networks that we have access to. So we've shared it with our prevention providers. We've shared it with community-based organizations. We've shared it with our local districts. I believe we've even shared it with our parent advisory board, because we do have a parent advisory board. We've shared it through our school contacts, but we're always, you know, looking for, it's on our website, but we're always looking for opportunities to be able to continue to make sure that folks have awareness of it. So I'm also happy to send the information to Paige to be able to share with folks on this call if you have not had an opportunity to see it firsthand.
Thank you so much, and we'll be sure to share that out. I'm seeing a follow-up question in the Q&A that I think is very appropriate to this, and I can click answer live so you can see it. But it's essentially asking, what is OCFS doing to make, to address school personnel, which makes up a huge amount of the SER calls that come in. That's a central registry for folks listening who may not know. And how is OCFS ensuring that updated mandated reporter training is being completed in Department of Education system? And also, I mean, I would add on to that another huge source of calls is through the healthcare system. So in both cases, is there any outreach and collaboration happening between the state and those sectors?
So certainly on when it comes to educational neglect reports, there has been a lot of collaboration with our partners at State Ed. Some of the work that we've been doing around ed neglect came out of around the pandemic, where there were concerns that were being raised in regards to whether or not the schools were able to reach all children to ensure that there was still a connection with receiving their educational rights and programming. And as part of the conversation, what we really wanted to sort of get to is, are kids not showing up, or are there barriers? Do they have access to a computer? Do they have access to a Wi-Fi? Things along those lines. And so we've really done a lot of work around when a call is coming in for educational neglect. There are targeted questions that the SCR worker is going to be asking in terms of what are all the exhaustive steps that that person has made to try and engage the family before reaching out to make a CPS report. Have you had someone go out to the home to try and connect with the family? We really want to make sure that all exhaustive measures have been taken before registering a call for educational neglect, and that if there are barriers that are outside of the control of the parents, then what supports have been extended to be able to address them. Additionally, in terms of healthcare providers, I think a lot of the work that we've been doing is around plans of safe care and around, parents, in particular moms who are giving birth. And if substance use is a concern, how are we approaching that? There's actually federal statutes around plans of safe care and working and how we approach that. And so have really done a lot of collaboration with our partners at Department of Health, as well as with OASAS in regards to how we are assessing the circumstances, is starting with a threshold question of are the child's needs being met or not met, in terms of really determining how we what is the level of intervention that is needed. One of the things that we had to recently modify was how we take calls or not related to use of cannabis. So with the recent changes, decriminalizing marijuana, prior to that, the threshold for registering a report looked different. Now it's not someone just on the basis of using marijuana does not automatically register a report. Similarly, as just because someone drinks alcohol, that doesn't automatically register in a report. It's what is the impact? What is the safety concerns there? So it is something that we continue to work with our stakeholder partners in terms of, the practice of how we work with families.
Thank you so much for fielding that follow-up question. I'm now going to kick it over to Melinda Agnew from Syracuse. Go ahead, Melinda, ask your question.
Good afternoon, Deputy Commissioner Gale.
We're
Um,
going to be formal, Melinda.
My name is Melinda Agnew, and I am a parent with intersectional lived experience, particularly in the realm of child welfare. Based in Syracuse, New York, and I do serve as the family policy advisor for my region. I have 3 children diagnosed with mental health and behavioral health conditions. My journey has been marked by many challenges. Unfortunately, I've faced unjust criminalization due to my children's behavior, including being incarcerated when they ran away during an open CPS case. This experience has left me deeply traumatized and stigmatized by the very systems meant to support families like mine. How can parents like myself access services and assistance free from bias from these systems without fear of criminalization in response to our children's behaviors and without further traumatization from child and family serving institutions?
Thanks, Melinda. And thank you for being vulnerable with sharing what has been your experience as well. You're speaking to what we've been saying. We need to lead this work with equity. We need to recognize what historically has not been equitable interventions and approaches to this work, especially when it comes to children and families of color. And we need to own that and then be better and do differently. Part of this, you mentioned a couple of other systems in the experience that you've had. So this is part of the cross systems work that we have to do with other systems stakeholders as well. The messaging of across the board, this work has to be done through an equity lens. And really taking the time to appreciate all of the circumstances that is happening with a family and really what is the appropriate approach and what is the services and supports that a family truly needs. I think we have to be very mindful that our system is traumatizing, right? And oftentimes when we are working with families, there's already trauma there. We have to be very mindful that we're not exasperating that we're not adding to that if we are there to support, then we have to support. And so that is the work that, when we talk about systems transformation, that's what I will say that I personally think about is how do we do this work? I often say to folks that, we're not making widgets here, folks. We are working with families. And oftentimes when we are no longer there, when we walk away, the decisions that we've made can have long-lasting impacts. So we really have to think about that in a meaningful way when we are working with families. And so those are key aspects of the conversations, that's part of why we introduced why we've done the implicit bias training, why we've introduced the blind removal policy, because, we have to make sure that we're checking ourselves, that our decision-making objective is if just based on the facts alone, are we making the same decisions regardless of race, ethnicity, creed, things along those lines. So as well as I do, it's a work in progress. That's why, appreciate that you're here at the table because you can use your own personal experience to really give us that lens and to inform our policy and our practice as we go forward.
Thank you so much, Gail, for answering my question.
No, thank you, Melinda.
Yeah, I really appreciate that response and just speaking, I think a little bit on behalf of the audience and the network, so many of our families in the Families Together and Youth Power Network are people who have experienced mental health challenges within their family. And so many relate, I think, to Melinda's experience of a sense of being afraid to ask for help in fear of the consequences of inviting people in who are mandated reporters, and the experiences they have. Sometimes their only experience with CPS as a parent navigating mental health on behalf of their child is because of those crisis moments that Melinda was talking about. So I really appreciate your response, Commissioner. I do hope things get better. I'm going to now pass it to TJ, who has an additional question specifically around poverty.
Hi, Deputy Commissioner. Good afternoon again. My name is TJ. I hail from Brooklyn. I come with a personal experience of being born into poverty within low-income communities characterized by violence, drugs, and a lack of resources. Growing up in such environments, survival is a daily challenge, let alone thriving, which often seems reserved for the exceptional few with familiar resources and support. Given the undeniable link between poverty and child welfare involvement, how does the state intend to confront these pressing issues, particularly in light of potential misalignments of priorities, such as the proposed football stadium in Buffalo? Additionally, what measures does the state plan to implement to ensure a living wage for all residents, access to financial supports, access to housing, and other key resources needed to thrive, while also addressing the disproportionate impact on communities of color in the face of these obstacles, such as child welfare investigations?
Thanks, TJ. Got it right this time. I really appreciate your asking this question, because when I talk about the narrowing of the front door and really distinguishing what is about abuse or neglect versus what is about resources, this is a key component of that work. You know, we know that oftentimes there seems to be this equating poverty with neglect, which that is not the case. You know, poverty is about resources, right? Being able to have the ability to meet basic needs. And so we've been doing a lot of work around economic and concrete supports. We've looked at the research that really speaks to that if families have the economic and concrete supports to be able to meet basic needs, we've seen a correlation where the number of families that are coming to the attention of child welfare for just neglect alone decreases. We actually implemented what we call a direct cash transfer pilot. It started in August of 2023. We are working with families in 3 counties in New York State, Onondaga, Westchester, and Monroe. It's a total of 150 families that are receiving a stipend of $500 a month for 12 months. So it equates to $6,000 within that 12-month period. And we're working with the Center for Guaranteed Income Research at UPenn. It's a randomized control trial. And the research component is really being able to demonstrate what is the impact of receiving that additional stipend in terms of future involvement with child welfare. We certainly saw the difference that it made for families, especially during the pandemic, where there were those additional fiscal supports that families received, whether it was the changes in terms of how to be able to access SNAP or food stamps, as it was called previously, looking at the earned income child tax credit, all the ways in which having that additional economic resource to support families makes a difference. So I'm sometimes, mystified, if you will. I'm going to use the word that was used previously in terms of why that seems to be something that folks almost want to sort of discredit, that, just the provision of additional economic support somehow is not a way to be able to support families. I'm not saying it's the only way, but we have to have that as part of the equation as well, right? Recognizing that fundamentally basic needs have to be met. And then we look at what are the other ways to be able to support. So that is part of when we talk about the family first and the work that we're doing here at OCFS. It is definitely looking at economic and concrete supports as one of the components of how to be able to move the work forward. When we talk about livable wages, and the other areas of concerns that you've raised, that's where that cross systems work and collaboration needs to happen. I am certainly aware that, you know, there's work that is happening with other partners, such as the Office of Temporary Disabilities Assistance. They're spearheading the anti-poverty reduction work. And so, you know, these are areas where those collaborations, those partnerships, being able to be at the table when those discussions are happening, because, you know, when we look at this really through the lens of social determinants of health, you know, oftentimes what, you know, sometimes gets situated under child welfare is really about public health. It's really looking at what all families need to be to sustain and thrive. And so really then looking at the space and the comprehensiveness of that work outside of just child welfare, and really everyone who has ownership of being able to support and see families thrive. Again, I don't know if I fully answered your question, but
You did. In fact, I unmuted myself for a second just to bring up social determinants of health. So great minds think alike. I really appreciate you bringing that up, because I think so often in this system, they don't see it as a public health issue, but it really is. And instead of seeing, you know, recognizing those social determinants as being also affecting our involvement in this system is so important. Thank you for bringing that up.
I fully agree. And in our policy agenda, in the list of Families Together Zone priorities, and we'll be advocating for this. We have been, and we'll continue to, especially on March 19th. You know, we have a statement that says that poverty undermines family well-being, and that we need to invest directly towards the essential needs that families have to alleviate the conditions in which families are raising their children. And what you're talking about, I think, speaks directly to that. And I'm glad you mentioned the earned income tax credit. We're pushing that. That made such a huge difference, and when that was national, and it made a huge difference when it went away, when they phased it out. And on the state side, we're pushing for things like the working families tax credit. We're pushing for things like the milk allowance for new parents, new families, for that first 1,000 days. We're pushing for childcare. We're pushing for housing vouchers, and so you're so right that all the things that you could imagine a family would need to thrive is true for any family. And it's unfortunate, the families that are involved in the child welfare system are usually the ones that got caught up in it. Their uniques are no different than anyone else's. And so I really appreciate your comments on that, and how you're seeing that big picture, and thinking about social determinants of health, not as something to be mindful of, but to actually trying to change and alleviate and improve. So really appreciate your comments there. We are running low on time. There was someone who asked for some explanation of the childcare system overall. I don't think we have time for that, but let's bookmark it. That's something that maybe we can invite you into our network to speak about in the future. I'm going to ask, and Zach's nudging me to share out the evaluation. So Zach, if you can share that, and for folks on the audience, this is very important. We have many different grants and things that we report out on, and so it's important for our reporting. But also, in addition to that, it helps us do a better job. Your feedback is going to let us know what things we want to improve, if you found this experience to be meaningful. So all that's really important. That's why we need you to fill out that evaluation. So please do that. I'll pass it back to Paige to close out.
Thanks, Brett.
am I to understand others were invited to talk here? Because I'm like, we're at
Yes.
left.
You must be exhausted. So thank you so much, Gail, for taking the reins on this, because yes, the Senator Bisbor also their session calendar changed, their schedule changed on Friday afternoon. So we just learned of that during this, that he was unable to attend. Both he and Assemblymember Hevesy are very committed. They usually are a part of this town hall, and I'm sure will be in the future. They are very much good partners, as you know, and great to have at the helm in those two houses because they listen and they are it's very clear that they understand all of what we just talked about, and they will have access to this recording. So I want to say thank you to both of them for agreeing to come, but unfortunately, both of them beyond matters beyond their control. But also, Gail, again, thank you for your commitment to our families and to our young people, and for taking the time. I know that you also had a conflict and that you rearranged for us. So it demonstrates how much you care about how you consider us important, our families. So I want to remind everybody again that we have a town hall on youth justice on Wednesday. Please join us for that. And also to please join us at the Family Empowerment Day, which is on Tuesday, March 19th here in Albany. And you can go to our website to register for both of those. Thanks again, everyone.
Thank you. Take care.
Okay.
Take care.